Scott Abbott. Okay, start over. My name is Scott Abbott. I'm the Mental Health Services Act Program Manager for Lake County Behavioral Health Services. And I want to welcome everyone out. Appreciate you taking the time to be here. It's the first thing I want to say. What the purpose of this meeting is, this is actually a continuation of the meeting that we had the first week of February, where we kind of ran out of time. We were talking about, kind of where MHSA is and what we didn't get the chance to really garner participants' feedback. And so that's the purpose of this meeting is to do that. And so, prepare to speak up, because this is when we're going to be looking for your feedback. Okay, I'll turn it back over to Aditi, who's our RDA consultant. Is doing a fine job of moving this meeting forward.
Thank you so much, Scott. Hello, everyone. It's great to see you all here. Thank you for making this very important meeting. As Scott mentioned, my name is Aditi Das, and I am with RDA Consulting. We are working very closely with Lake County on the MHSA planning process for the 3-year plan. I also have my colleagues, Jamie Dorsey and Paulina Hatfield on this call. So I just, kind of wanted to move us along. We can, this is just an introduction slide where we would really love for you all to use the Zoom chat to introduce yourselves, ideally with your name, your preferred pronouns and programs. And just a quick plug, we will be getting into some breakout rooms, and so then we can have an opportunity to formally introduce ourselves. So just in the interest of time, if folks can actually use the Zoom chat to introduce yourselves, that would be wonderful. It would be really helpful for us to know who's in the room right now. Thank you. All right, so let me get right into our agenda for today. So just as Scott mentioned, we're kind of doing a continuation from the first community stakeholder meeting that we held in early February. And so as a part of that meeting, what we're going to begin today's conversation with is to provide an overview of the MHSA training and education, what sort of MHSA entails, a background, and the context of what MHSA is, and also kind of talk through what the 3-year plan and the community planning process is. And so this community listening session is very much feeding into the community planning process. And as I describe and talk about the entire process, you'll all get a clearer sense. And so definitely, as I'm talking through, feel free to continue to use the Zoom chat or raise your hand if you have any additional questions or clarifications that you'd like. And then, of course, in addition to providing an overview of MHSA and the community planning process, we are going to get into breakout discussions, which is very much focused on the needs assessment piece of this, where we would love to hear your thoughts and perspectives. And that's really why we're hosting today's event, because we want to invite your participation. And so, as you could see, the key objective of today's conversation is really to provide an opportunity for all stakeholders to discuss the community program needs, especially with an eye towards thinking about the 3-year plan, which is from financial years 23 to 26. So that's really the purpose and the intent of today's meeting. Just a couple of housekeeping items. These are different ways of how everyone can contribute to the discussion. So as I'm assuming folks are now fairly familiar with the functionality of Zoom, but I'm just going to kind of walk over some of the key ways of how everyone can contribute to the discussion. So right here, you at the computer screen, right at the bottom, you have the participants icon where you can raise your hands. Please feel free to completely do that. And then my colleagues and I will make sure we get to answering your questions or clarifications. For those of you who are joining us on the phone, the raise hand function is the *9 option. So once you do that, that basically prompts us to know that we will respond to your question. In addition, of course, we have the Zoom chat. Thank you for those who've already added to the Zoom chat while you're introducing yourselves. We'll continue to do so. And also, please add your questions. We will definitely take note and provide clarification as we can. And in addition, we had Scott introduce himself. We have Scott's email right here. Feel free to send your comments over via email to Scott. We definitely want to invite and hear people's thoughts and perspectives. So, really want to encourage that participation. Great. I see a lot more introductions coming in. Thank you so much. Feel free to continue to do that. All right. Let me just actually get right into it. So as I mentioned, the first section is the Mental Health Services Act training and education piece. So I'm going to just kind of give everyone an overview of what that is. So as folks might be familiar, so MHSA was really born out of Proposition 63, which was passed back in November 2004. It's essentially a 1% tax on an income over $1 million. And the intent of MHSA is really to expand and transform the mental health, the public mental health service system. And so one of the ways that MHSA accomplishes this is sort of these 5 buckets that you see right up here on the screen, where all of the public mental health services are really focused on wellness, recovery, and resilience. The client and the families are really at the heart of the services, so it's very much driven. It's a very client-centered approach. The entire sort of programming and services are culturally competent. The service experience is really very collaborative and integrated, and a lot of the program is really driven by the community. And so that in many parts is sort of talking about this community planning process, which we're all engaging in currently. So again, just to give folks an overview of the different key sort of funding brackets that comprise of MHSA, these are broken down into 5 different categories. So right at the top, you see CSS, which stands for Community Services and Support. It makes up the largest percentage, about 76% of MHSA funding. And the focus is really on outreach and direct services for those with serious mental illnesses, really across the entire age spectrum. And then following that, you have the PEI piece, which stands for Prevention and Early Intervention. This is really focused on preventing the onset of mental health problems and provides opportunities for early screening and assessment. And then following that, you have about 5% of funding that's focused on innovation. That's the INN funds, which is really focused on testing new and innovative approaches to improve outcomes for folks who are a part of the behavioral health system. You have WET, which stands for Workforce Education and Training, which is very much focused on strengthening, training, and improving the public mental health workforce, who really are at the forefront of the provision of services. And then we have CFTN, which stands for Capital Facilities and Technology Needs, which is really, talking about sort of the overarching infrastructure support. So this includes things like mental health facilities, electronic health records, because that information is really important to sort of support the delivery of services. So that's really how the funding is broken down for MHSA. I'm not going to read out this entire list of programs, but I'm going to just kind of put it up on the screen, but just explain a little bit about how these programs are broken down. So just in the previous slide, as I talked about the different funding buckets, you have a host of programs that are on this slide, which are listed under each of those buckets. So you could see under CSS right here on the left-hand side of the screen are all of the community services and supports programs. I'm sure these are familiar especially for those of you who are engaged in this. You have then right in the middle, you have the list of MHSA programs under PEI. The INN sort of talks about the multi-county full service partnership collaborative that exists. CFTN, as I mentioned, is really very much focused on capital facilities and the electronic health record project. And WET, as I mentioned, is really focused on the workforce education and training piece. A quick note that the outreach and engagement programs, as well as the peer support centers that I'm sure folks might be reasonably familiar with, they receive funding from cross-funding from both the CSS and PEI. So that's really the way this entire sort of LCBHS MHSA system is broken down. So I'm just want to give it a minute for folks to look over the slide to get a sense of the kinds of program that exist. All right. To learn more about this, we definitely urge everyone to definitely look at the LCBHS MHSA website. There's definitely a lot more information and detail that's provided. So feel free to access this web link as you're looking over these details. Thanks, Paulina. My colleague just dropped the link in the chat. All right, so moving forward, I want to then get into and talking about just the 3-year plan and the community planning process. But before I do that, I just wanted to pause for a quick second to ask folks if they have any questions or clarifications just about the MHSA background and overview. I don't want to. Oh. Okay, great. I suspect there'll be more questions coming in the community planning process. So feel free to continue to use the chat function or raise your hand or just let us know if you have any questions about this. All right, so section 2 is focused on talking about the 3-year plan and the community planning process. So we kind of want to talk about what, and this is really where RDA Consulting is working very closely with LCBHS, and that's really why we're hosting today's meeting as a part of this. So the purpose of the 3-year plan, right up here on the slide, is to identify persistent mental health service gaps and really develop strategies to address them over the next 3 fiscal years. And this is really going to be driven in many ways by the community needs assessment process and stakeholder inputs. So we started off, and as a reminder to folks, we held our, sorry, could I request everyone to mute themselves? Thank you. Thank you so much. So we started off with the programs providing a status update and talking about their service accomplishments. We actually had that in early February, just the meeting that Scott was referencing. And we also have those details up on the LCBHS website, so feel free to look at that. There's both a recording as well as the slide deck. So you'll definitely have a very good overview in a sense for what programs have been doing, especially in the past year. The second part of this is really focused on proposing program plans for the next 3 years. So it's really sort of very much focused on looking forward and looking ahead, as well as thinking through what are some immediate program changes that are going to be instated in this upcoming year. So that's really the intent and purpose of the 3-year plan. And then as a part of that, embedded within this is the community planning process, where the intent of MHSA is that there be a meaningful stakeholder process, because we're really leaning on stakeholders to be the subject matter experts to help in the development of these plans, which are focused on utilizing the MHSA funds at the local level. So that's really the drive and the focus of what the community planning process is. A very quick note about the PEI evaluation reporting. So just know that as a part of sort of the broader MHSA reporting, there is an additional requirement within MHSA to provide more details about the prevention and early intervention reporting. So in FY 18-19, the overseeing committee basically updated their PEI reporting requirements to include an evaluation and more sort of in-depth evaluation of the PEI programs. So this includes 2 kinds of reporting requirements. You have the PEI annual report and then the PEI 3-year evaluation report. So the difference between the 2 is that the PEI annual report is really talking about details about the PEI programs, things like which consumers were served, how were they broken down by particular demographic details, and the kind of program accomplishments in the previous fiscal year, as well as some specific program implementation and outcome information, which is really based on the specific PEI service area. The difference between the annual report and the PEI evaluation, the 3-year evaluation report, is that the 3-year evaluation report really looked at these similar categories, but looked at the previous 3 fiscal years. And so for this particular, that is for the 3-year planning process, we're actually going to include the PEI annual report from last year, because LCBHS has been working, and in addition, LCBHS has been working with all programs to strengthen data collection and outcome reporting, and the PEI programs to strengthen PEI specific reporting. A quick note that we actually included the PEI 3-year evaluation report in last year's annual update. Sorry, that might be kind of confusing, but just know that all of these materials and information that I'm talking about are available, and you can access them on the LCBHS website. So for this year, we will be focusing on the PEI annual report. All right. Any questions? I definitely want to invite any questions if folks have them. All right, I don't see any hands raised at the moment. Feel free to use the Zoom chat as well, please. Thank you. All right, so getting back to the 3-year plan and the community planning process. So right here, you can kind of get a sense for really the variety of MHSA stakeholders. This is really anybody who touches the mental health system within Lake County. So right from consumers down to providers, as well as additional collaborators like education, social service agencies, healthcare organizations, amongst others. So, program planning, really our intent and focus is to really try to get variation in perspectives, and really, I think just looking at folks in the room today, I can get a sense that we have stakeholders really across this spectrum, and I'm very excited about that. All right, so let me walk through again some key roles and responsibilities of folks who contribute and are a very important part of this entire community planning process. To begin with, as I mentioned, stakeholders, your thoughts and perspectives and your lived experiences and how you have, really engaged with the mental health system is the focus and the heart of this entire process. And so we start with the stakeholders, and just know that the MHSA process is very much driven by community needs. So stakeholders are one of the really key contributors to this entire conversation. In addition, you have the Behavioral Health Services Department. So Scott and a lot of folks under the LCBHS system, they're focused on developing this 3-year plan and in many ways are helping shape it moving forward. We have the Mental Health Advisory Board. This is an advisory board that helps really provide the advice and recommendations and review the MHSA 3-year plan, as well as conduct the public hearing. I'm just going to talk about that in a second. We have the Board of Supervisors who will review and approve the MHSA 3-year plan. And then finally, there's us, RDA, where we're really, you sort of think of us as we're trying to sort of facilitate this entire conversation and put a lot of the needs assessment process as it's going to influence the 3-year plan. So that's really sort of thinking about some of the key roles and responsibilities. And here you can kind of see this is what these are the different kind of planning activities and the overarching timeline that's associated with this project. So what's highlighted in green is really where we're at. We're in phase 2 of the project, which is, as I mentioned, very much intended to be a needs assessment process, where we kicked this off with launching a stakeholders survey. And then we also had our first community meeting in early February. Since then, we have been conducting focus groups that with consumers specifically, as well as focus groups with providers, and we will continue to do that. And then in addition, we of course have the community listening session, which will contribute to the needs assessment process. So at the end of this, we will then get into the following 2 phases. We have the program planning phase, which is in March, it's sort of March and April, where we will synthesize the stakeholder input on needs and services. And we will actually be reporting back to everyone just based on what we heard during the needs assessment phase. And so a quick plug, we will be hosting another community meeting. This is going to be on the 23rd of March. So definitely look out for more details that are forthcoming. And then finally, in phase 4, we have the actual plan development. This is slated to happen in May to June, where we RDA along with LCBHS will develop the 3-year plan. We will publicly post that plan. We will, and that's going to be publicly posted for a 30-day period, following which we will host a public hearing. And then really we will finalize this 3-year plan and present it to the Board of Supervisors. So that's really the last step in this process, so that folks are familiar. All right. Any questions? Just want to pause for a quick second. Okay, just want to make sure we're doing okay on time. All right. Okay, so again, very quick overview. This is for just kind of like a reminder to folks. So Scott mentioned this at the beginning of the call, and I sort of alluded to this through this presentation. Is in early February we hosted our first community meeting, where the intent of that meeting was really to have programs. Each of these programs come in and present and talk through what their programs have accomplished. So really, what we had done as part of this process is we had sent a list of questions that we asked programs to report out on. So these included things like strengths as well as some sort of outcome measures as it relates to their strengths. We talked about areas for improvement and opportunities for growth and the kind of support that programs are looking for, as well as getting a sense for what programs are really hoping for moving forward. And so, it was a very amazing sort of opportunity for programs to talk through this process. And we actually have a lot of that detail in the slide decks, as well as there was a recording that happened, which has been posted on the LCBHS website. And so I would definitely request and urge folks to take a look at that if you're interested to understand what that sort of program report out and status update looked like. All right, I see a comment in the chat. Oh, great. Thank you so much, Lynn. Appreciate that context. Thank you. Thanks, Paulina. Right there. Yeah, my colleague Paulina just dropped the link to where you can access both the community meeting slides as well as the recording, where you can get a much better sense for the program report out details, because that was really what we were focused on at our first meeting. Okay, I'm going to pause a quick second because, this is basically where we get into the stakeholder discussion, where our intent is to break the group out into different breakout groups. So before I do that, do folks have any questions just about this process or any background clarifications about MHSA as a whole?
This is Kim Tangerman. I just wanted to mention that I was working with the Hope Rising and all the people on that board. They did a CHNA. Some of them had to do it, and others, participated. They're also working on a CHIP right now, which is the improvement plan. And one of the pillars is behavioral health. And I just really want us to be mindful of aligning the work that they're setting out to undertake, so that it aligns. These are 15 agencies, key agencies in the community, and I definitely would want to make sure that we're aligning this effort with that effort and their effort with our effort, that kind of thing.
Thanks, Kim. Thank you for bringing that to our attention. Scott, did you want to respond to Kim?
Yeah, I think not only just MHSA, but just behavioral health in general would want to align with that.
Yeah, they're working on a document right now. It's in a rough draft form, but all of it has a lot of meat to it, and it's really wisely developed. So as soon as it's able to be shared, I just asked her for the rough draft of it because I was going to look over it real quick and put in any information that I could that aligns with what we've got going on here, or maybe an aha moment of some sort. But it's not a final draft yet, but it's in the works. I think they need it done completed by May or something. So there's time to align. There's time to, massage each effort,
Mhm. And behavioral health's been representative on that board, right, with Todd and yeah.
Mhm. In the meeting right now, though, there wasn't, I didn't see, I switched off from that one, and that's why I was late to this one. I didn't see that behavioral health was there, but, it's social services, it's the hospitals, it's Patty from North Coast Opportunities, so it's all the players that we all intermingle with. And so to align the efforts around what we're looking to do here and what we're looking to do there, I think is pretty key. And it's a perfect, timing is perfect.
Yeah, it is.
Thank you so much for sharing that, Ken. It's really helpful. All right, any other questions or clarifications that folks would like, or any, again, context information that would be helpful for us as we're putting this together? Okay, so if it's okay with everyone, I'm actually gonna get right into the stakeholder breakout discussion. So before we do that, I just want to mention that, well, I think in the outreach that Patty has shared out with everyone, we had sort of provided some of the questions that we were going to get into in our small breakout groups. And so I'm just going to kind of walk over these 4 key questions that we're going to cover at each of the breakouts. So the first one is really focused on, what has been working well within the LCBHS system of care, and really sort of urging folks to think about some of the key strengths that the LCBHS system has to offer. The second question is talking about just, what have been some of the biggest challenges with the behavioral health system in Lake County? Where has the system not worked for the community? So this is really kind of identifying some of those gaps and challenges that continue to persist. And we would love to hear folks' thoughts and perspectives on this. And so sort of related to that, you can see, what are the biggest gaps or especially needs in the mental health programs and services that are offered in Lake County. And then really our last question is focused on what can be done over the next 3 years to better address these gaps and needs. And so as you can see, this question is really sort of an exercise in reflecting back on the sort of gamut of services and programs that have been a part of the LCBHS MHSA system, and then really thinking about identifying needs and what can be done in terms of strategies and opportunities for growth and improvement looking ahead, especially for the 3-year plan process, which is really where we're at right now. So I am actually going to stop sharing real quickly, and then I'm going to go ahead and set us up into breakout rooms. So Jamie, do we know how many people we have and how many folks per room, so that I'm kind of just like manually doing that a little bit.
So right now we have 25 total, but if we exclude the 3 of us and Scott, then it's 21.
21, okay. So 7, right? Okay.
Well, including us 8, yeah.
Yeah,
But
okay. Sorry, just give me all a second. I just want to make sure everyone gets assigned. All right. And please note that this is really a random assignment. We're not, this isn't, I'm not thinking about who's in the room. This is just me randomly assigning folks to the 3 breakout rooms. So, all right, I think we've done that. Yeah.
Pauline, I was asking if Pauline, maybe she could post those questions in the chat.
Yeah, that'd be great. Yeah, thanks, Scott. We'll do that. All right, so just note that Scott, Carrie, oh, Patty, did I assign you to one group? Let me see. I don't think I did. So Carrie and Scott, I haven't actually assigned you to any of the rooms, but hang around because we will come back. Oh, before we actually go away into our rooms, I wanted to mention the format that, the intent with the breakout rooms is that we're going to have really hopefully a very a fruitful discussion around these questions where we really want to learn from everybody. And then we're going to spend about, I'm just looking at my clock here, about 45 to 50 minutes in our small breakouts. And then we come back to the main room where once we're back, Jamie, Paulina, and I are just going to provide a really high level overview of what was discussed in the group so that all the three groups have a sense for what those discussions were. And then we're going to just quickly walk through next steps of what you can expect as a part of the MHSA community planning process. And then we'll kind of end there. So just a quick note about what that process is going to be. All right, I think I have everyone in here. I just want to double check. Okay, so I'm going to send you all to the breakout rooms, and I will provide a 5 to 7 minute warning once we need to kind of come back to our larger groups. So go ahead. You should have all got an invite right now. Thank you. Looks like we have a few folks who are back here. We're just going to wait for the other breakout groups to return. Thank you for your patience. It looks like some more folks. I think Jamie's group. Oh, there we go. Jamie, Paulina, just quick check and make sure your group members are back.
Yeah, and let me just say, so I think we got cut off as we were doing our checkout. So Barbara and Elise, if you two want to just put into the chat, maybe we were ending with like in a sentence or two, what would be your kind of hope or vision for Lake County Behavioral Services in the next 3 years for the two of you, since you got cut off? Do you want to just drop it into the chat and I'll make sure I get it in the notes? Or you can direct message me if you don't want everyone to see it. It's just Jamie Dorsey.
Sorry about that, Jamie. I didn't mean to
no,
snatch everyone away. I apologize if that was the case. I definitely. Right, so thank you. It looks like we have all of the folks who were in the breakout groups back. So for this piece, we're just going to spend the next 5 minutes or so just hearing sort of high level what the conversations were at the 3 breakout groups. And so Jamie, could you kick that off, and then it would be Paulina and then I. So just spend about 2 or 3 minutes to give us sort of a high level overview of what was talked about. That'd be great. Thank you.
Yeah, I mean, I feel we talked about so many things. It's hard to condense it down to just a couple of minutes, but some of the things that we talked about, like some of the populations in need, are really focusing on like family and services for children, and kind of getting more into the community for those. We also talked a lot about actually just like having more community health workers and kind of peers and folks who look like the community and live in those neighborhoods and can kind of provide supports and build trust with the communities that they work in. One of the things that we also talked about was just staffing. I think this is like a ubiquitous challenge across, the nation, but also in Lake, of how challenging that has been to actually get into some of these other services, particularly clinical services. We talked a lot about kind of transportation and how that's a barrier to getting folks to the services that they need, but talked about some different ideas of, like more gas vouchers or kind of transportation services, expanding on telehealth. Some of the other things, some of the strengths that we talked about were like the crisis services and the kind of movement toward maybe expanding those and looking into what a mobile crisis model could look like, as well as the existing peer support centers. Another challenge that we talked about was like that in some of these cases, there might be like a grant funded program that when that grant funding ends, it can be hard to kind of get steam behind continuing those programs, particularly things like the arts or things that we know support mental health, but maybe aren't directly mental health. These are some of the kind of the key things. Does anyone else from my group want to jump in if I missed something that feels really important?
I think you did great, Jamie. Thank you.
Oh, thank you.
I
And thank
agree.
you all for your
Jamie.
discussion. Yeah, but we have the notes, so there was a lot more said, a lot more detail, but I'll kick it over to Paulina.
Thank you, Jamie. So our group had a really good discussion. And to kind of summarize it, so one of the biggest strengths that was talked about is like the passion and the raised awareness of staff across the board on wanting patients to recover and to succeed. That's been a huge strength of the system. And it's people in my group also really highlighted that this wasn't just like a post-pandemic change, but was just kind of like this natural rise of just wanting to make sure that everyone in the community gets in the resources they need to succeed. So that was really great to hear. And then with challenges, my group spoke a lot about coordination, collaboration, and communication just between different agencies and partners. That sometimes it's really difficult to kind of see the continuation of care that clients go through, knowing when they're discharged, where they're going to next, being able to follow up with them appropriately. So that was one of the big challenges that was discussed. And then for groups or those who may be falling through the cracks, similar to what Jamie was saying, we were talking a lot about youth, specifically those in schools. And so having more mental health and behavioral health services on school campuses or adjacent to, because of transportation issues, parents not being able to get off work until 5. So students have a way to get the services that they need, especially if they're in crisis in that moment. So a lot of talk about youth. And then on the flip side, very similarly, also with older adults, because with transportation issues, mobility issues, it's also really advantageous to have services very close to where they are. And so those are probably the two biggest populations that were spoken about, and those gaps. So yeah, if anyone else from my group wants to share out if I missed anything, but if not, I'll kick it over to Aditi.
Just want to provide an opportunity if folks wanted to add to what Paulina said. Okay, feel free to unmute yourselves and please chime in or add your comments in the chat. Very similar to Jamie and Paulina, our group had a really robust, rich discussion. We had a very, really interesting sort of mix of folks in the room. But I think in terms of just sort of starting off with some key strengths that were identified, there was definitely talk about how, the installation of the peer support centers and sort of the community outreach work has yielded, some strengths and have really helped some of the communities, along with some of the continuum of care work, especially collaboration with agencies like Adventist Health, as well as sort of streamlining some of those databases were identified as some of the key challenges. I will say, though, a lot of our group did spend and talk a lot about some of the gaps that they are witnessing, especially from the vantage points that they sit at. One of the biggest ones being that even though, there is this focus on the mobile outreach van and crisis intervention services, everyone in the group kind of talked about how it's really important to think about more upstream preventative work that can sort of, just really not really put in all the emphasis and focus on the crisis per se. And I think related to that, there were concerns about, how law enforcement ought not to be the first point of intervention when it comes to crisis intervention, that you really need to have mental health specialists who are at the forefront of that work. In addition, along the sort of lines of that, folks talked about how just staffing, in terms of just not having sufficient staffing within LCBHS and the program providers, but outside of that, just, how do you retain good quality staff? I think that was a really interesting and important conversation, just kind of broadly touching upon and talking about just what are the tenets that Lake County can do to retain some of that really important workforce, because a lot of it was sort of synced up to the fact that there are those gaps and needs. In addition, there was some specific populations that were talked about that have been sort of falling through the cracks or where mental health needs have not been addressed. Folks talked about services focused on the 0 to 5 population subgroup. They talked about the fact that affordable housing, and it's not just folks in the low income bracket, but also middle income bracket who kind of struggle with that piece, and how their access to mental health is proving to be a challenge. Clients who have sort of substance use issues and challenges, youth who identify as LGBTQ+, sort of talking about how there is a need for more services and support that needs to be provided to the group. And I think the other big piece is kind of similar to the point that Kim raised in the larger group, that it's really important for LCBHS and MHSA to really align their work and their thinking with what's coming out of the CHIP group. I learned about a Resilient Lake County program. And so I think it's, there was a lot of emphasis on talking about how these different systems of care can really align and collaborate instead of sort of working in silos to really kind of move the needle with some of the populations that all of these different systems are striving to serve. So really great discussion and very valuable perspectives that were shared. Anyone want to add to anything from our group? I know we're almost at time, but I did want to quickly walk over next steps. But before I do that, folks in my group, did I miss on anything?
I had one thing. I know I wasn't in your group.
That's fine, Jamie, go ahead.
I think the one thing that also came out of our group that I think is really important is how important like meetings are like this, or just any of these kinds of meetings, to bring people together with different perspectives, and kind of have these opportunities from sharing and learning from each other and like understanding the different challenges. So just for that, I really want to put in a plug that like we really appreciate all of you spending this time with us today and for contributing to like a really rich discussion. So thank you.
Yeah, and I'd like to say, listen carefully, and I'll be looking, forward to reading the analysis and the report that RDA will put together for this. It was really heartening to hear that some of the things that were mentioned and priorities that we're seeing are ones that behavioral health has been identifying, and has been, we've been talking about some of the same things. So it's nice to see there's some harmony there. And just want to assure everyone that, every comment that was made and opinion that was expressed will be, incorporated and listened to. It's, your effort today really makes a difference in what we do and helping guide us. So, I also say thank you very much.
Thank you so much, Scott. I know that we're over time. If folks could bear with me for just another quick minute, I wanted to give everyone a sense for where we're headed towards, so that you know what's upcoming. And again, I really want to echo Jamie's and Scott's thoughts and the fact that, we really appreciate the valuable contributions to today. So thank you so much for making today's call. So just quickly in terms of next steps, I think I mentioned this right when I was talking about the planned activities. We have our second community forum, which is on the 23rd of March. Look out, we're going to be sending, we've already sent invites, but we're going to sort of send reminders out to everyone. And really at that is what Scott's talking about. We will be presenting the needs assessment, which is putting together information from our stakeholder survey, from the first community meeting, from our focus groups with consumers and providers, as well as today's community listening session. So we'll be putting all of those different data pieces together and bringing that information back. So definitely would really request everyone to be there. We're going to learn a lot. And then, of course, from that conversation, we're going to be focused on talking about strategies and next steps. And then right after that, we will be developing the 3-year plan, which is going to happen in April. We'll be posting it for public comment in May for a 30-day period, and that is going to culminate at a public hearing in June. The other quick plug that I wanted to add is, we want to invite everyone to really participate in providing additional inputs. We have a stakeholder community-wide survey, which is going to be open until the end of February. I have my colleague who just dropped it in the chat. Some of you may have taken it. We'd really love for you to take it in case you haven't, and also really share it widely with your networks and teams. So really anyone who you think might be interested, because this is an opportunity for us to learn more and really offer up an opportunity for folks to chime in and add their thoughts. And then finally, thank you. This is again a quick note that access to the recordings, especially the first community meeting that was held in early February, is going to be on the slide. Kim, you had a question?
Just a comment.
Yeah, go ahead, Kim.
On my calendar, and the Hope Rising board meeting is on March 23rd as well, from 9 to 11. I'm wondering if there can't be an hour overlap between that board and this meeting to address mental health in a way that is aligning with what that chip is doing. I'm just throwing it out there.
Yeah, thanks for raising that, Kim. I think, sorry, Scott, did you want to respond?
Yeah, that sounds like a great idea. We can make that happen. That'd be perfect. Good timing.
Yeah, I think you raise a really important point, Kim, and I think we could definitely look at some opportunity for those groups to sort of come in, and we'll work out those details with LCBHS. So thanks for bringing us to attention. So very helpful. All right, well, with that, I just want to say again, I just want to reiterate how grateful we are for everyone who made today's meeting and added your really valuable perspectives and thoughts. Again, if you want any additional thoughts or comments, you have our email addresses right here on the slide, so feel free to reach out back to us. We really want to hear from you. And for those of you, and we do have some remaining focus group conversations for both providers and consumers, so we would like to urge you all to have folks join those meetings, and then definitely do come to our March 23rd second community forum. We're going to bring all of these results back to that meeting. So thank you so much. Have a great rest of your day. Bye.